Next up, Michelle is going to introduce our closing keynote.
I forgot. I can't believe it. I almost forgot.
Me.
Hannah Valantine. Oh my God. Hannah Valantine is the Chief Officer of Diversity at NIH. And I gave her this horrible job to do the summary and synthesize this entire conference. And
I'm not going to.
She is really, when I went up to Francis and Francis said, oh, I'll give you some money, you know, I thought it would be like a couple bucks here and there. And then I realized he was going to hand me over to Dr. Valantine. And I know she is an amazing advocate for women, so I'm going to let her talk. And she's also a very good, close, personal friend. So.
So thank you very much. I must say I am absolutely delighted to be part of this incredible conference here today. I'd first of all admit that I'm not in the field of global health, but as I saw what emerged today, I couldn't help thinking what an amazing way to cast this lens, a new way of thinking about how we increase leadership for women in general. We had so many new and wonderful pointers, but I think it is important for us to go back to what the mission of this meeting was. And I believe the mission around all of this, and this is what I communicated to Dr. Collins, was to enhance the numbers of women who are in leadership positions, and in this particular instance, within global health. But of course, we know that that refers to all of the sectors that we work. And why do we want to do that? What we know is that if we continue at this current pace, it will take centuries for us to get equality at the leadership levels. But you might ask the question, why does that matter anyway? And that's where the research comes in, and that's what you've heard a lot about today. Much of the research fully is conclusive that when we have women in leadership positions, we have better outcomes, period. And it's specifically the case when the outcomes you're looking for are really complex, like all of those that you work with in this field of global health. And in my little smaller area, I work in the field of cardiac transplantation, tiny in comparison to what you're doing. But even in that field, we know that when we have diversity of the people who work in that field, new questions begin to ask. For example, why is it that the outcomes are so much poorer for African Americans who've had a transplant compared to others? And this is the kind of excitement that has kept me in the field of doing my science, my research, as well as in this area of diversity, and in particularly enhancing women in leadership positions. The data tell us that, for example, in the field of medicine, to get to equity or 50-50, women as full professors, it will take another 50 years. 50 years. I don't have enough time to wait for that, and I'm rather impatient, as most cardiologists, so we've got to get our skates on to do something that is more effective. So what is that thing that we need to do? It starts by really asking, what is the case? And we heard some very articulate words about debunking the business case, that doesn't work. And I've often thought, why is it that when we know, money is really measurable, it's countable. The business world has known for years that with more women, it affects the bottom line. But it hasn't changed the number of women in the C-suites. And so that's why I really resonated with that discussion earlier on, that we must change the dialogue around here. It's not so much, we're not a business case. women are not business cases. We're much more than that, and it's much more about making the solutions richer, better, and better for everybody, including men. So what do we need to do about this? Much of the work that has gone on with growing and developing women have been very individually focused. So teaching us how to get over certain barriers, equipping us with tools. The reality is that although those individual approaches are necessary, they are not sufficient for making the kinds of monumental changes that we want. In fact, I say these days, don't send me to any other leadership courses. I'm not going, right? I'm not going to any. What needs to happen is that we need to change the institutional structures that are deterring women from getting to leadership positions. That's what we need to happen. And how do we do that? We have to link these things to the way we reward our reward systems within our institutions. What measures gets done and what gets rewarded will be done. So why is it that we do not have our reward systems linked to the degree of equity that is occurring, not only globally within the institution, but particularly within departments? So that's, I think, an important thing. We must create a culture of change, and that culture requires that we measure things and we evaluate them, and we look for inequities in the usual metrics, salary, resources, and we actually act on the inequities that we find. If we don't do that, with all of this, will continue to take a long time. There needs to be accountability. There needs to be transparency. I don't know if some of you realize that when you get a bunch of competitive people within an institution, let's say department chairs, and you start measuring things that are actually valued by the institution, and you show the data, it makes people sit up and look. And then, if you tie the reward systems to those metrics, we are going to see changes. So accountability, transparency, data, I think is part of the solution towards culture change. But that's not all. I really do think at the end of the day, the numbers matter. And if you'd asked me this question before, I would have said about 5 years ago that we should really go around looking for other ways of thinking about inclusion, create those environments that are more inclusive, and then the numbers will change. Well, it turns out there is research in this too. Social psychologists have shown that we walk in the room and we begin to count. And when we don't see people like ourselves in the room, we are then getting a sense of not belonging, a phenomena that has been described as stereotype threat. And that in and of itself can affect our performance. And perhaps this is part of the reason why not so many women are actually moving forwards to assert themselves into leadership positions. It could be a contributing factor, and it's something that we need to do, and the solution for that is not more training, it's increasing the numbers. And so that if institutions are held accountable to the numbers, I think that is a direction towards making the change. So this conversation needs to be had. The issue around inclusion needs to be addressed. And the issue of bias and the impact of it also needs to be addressed. But I think we are now in a pivotal stage. And in this relatively newer arena, when new disciplines are created, I think I view this as an opportunity to set things up in a way that it's positions for success. And that success is having more women in leadership positions. And I strongly believe that if we take that approach, we will be able to make those kinds of changes and the institutional transformation that we are all seeking for. So let me just leave you with the words of J.K. Rowling. And she wrote, we do not need magic to change the world. We carry all the power we need inside ourselves already. We have the power to imagine better. And I think this is the start of a great movement that will be able to create that advocacy around this institutional change, which has always been the missing piece in this work. So I thank you, and I hope you're energized and going forward for change.